Oh, hi, Dr. Artino. Ah, yes, Mr. Dannerson. Danny Dannerson, I presume. Good to meet you. Alrighty, well, let's just get down to business, shall we? Alrighty, your physical came out good. Cholesterol, good. Good. Hair, good. Eyes, good. Alright, this is new. Is everything okay? You can just give it to me straight, Doc. Oh yes, everything's okay. I just need to call in my colleague, Dr. Barroso, into the office just to go over a few things with you, okay? Just give me one quick second.
Yes.
Hi, yes. Could you please send Dr. Barroso into my office?
Sure thing, boss.
Thank you. Alrighty, she'll be right in, okay? Is everything okay? You're starting to scare me, Doc. Yeah, everything's okay. I just need to talk with her for a second, okay? Ah, here she is.
Hi, Danny. How are you feeling today?
I'm feeling good today.
Let's talk about your blood test.
Okay.
So it did come back positive for diabetes type 1. Do you know what that means? Have you heard of that before?
No, I can't say that I have it. Sounds scary. What is it?
When you have diabetes, the way your body processes blood sugar or glucose is affected.
Whoa. What do you mean glucose? What do you mean affected?
Glucose is what fuels your body's cells. It feeds them. And in order to enter the cells, it needs a key. That key would be insulin. In diabetes type 1, which is the one that you have, you don't have that key. So your body can't process glucose.
Oh, okay. All right. I think I'm starting to get it. Now, I'm a little confused. What do I need to know about type 1 diabetes, guys? Come on. Ah, well, I'm glad you asked. We have prepared for such an event. I'm starting to get a little bit more. Can you tell me what some symptoms are? Oh, alrighty. Well, let me give you some of those. So type 1 diabetes signs and symptoms can appear relatively sudden and may include increased thirst, frequent urination, bedwetting in children who previously did not wet the bed during the night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, and blurred vision. Yikes. Okay. All right. Well, is there anything else I need to know about this, guys? All right, Danny. Some things I want you to keep in mind are some risk factors. First, we got family history. If anybody in your family has had type 1 diabetes, then there's a slight increased risk in developing the condition. Next, we have genetics. The presence of certain genes indicates an increased risk of developing this kind of condition. Next, geography. So the incidence for type 1 diabetes tends to increase as you travel away from the equator. And lastly, we have age. Although type 1 diabetes can appear at any age, it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old. And the second is in children between 10 and 14 years old. Yikes. Okay. All right. Well, is there anything else I need to know about this, guys? Alrighty, Danny. Last thing we're going to look at are a few complications. Computer. Heart and blood vessel disease. Diabetes dramatically increases your risk of various cardiovascular problems, including coronary artery disease with chest pain, heart attacks, strokes, narrowing of the arteries, and high blood pressure. Nerve damage. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Poorly controlled blood sugar can cause you to eventually lose all sense of feeling in the affected limbs. Damage to the nerves that affect the gastrointestinal tract can cause problems with nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Kidney damage. The kidneys contain millions of tiny blood vessel clusters that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which requires dialysis or a kidney transplant. Diabetes can damage the blood vessels of the retina, potentially causing blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. Left untreated, cuts and blisters can become serious infections that may ultimately require toe, foot, or leg amputation. Skin and mouth conditions. Diabetes may leave you more susceptible to infections of the skin and mouth, including bacterial and fungal infections. Gum disease and dry mouth also are more likely. Pregnancy complications. High blood sugar levels can be dangerous for both the mother and the baby. The risk of miscarriage, stillbirth, and birth defects increases when diabetes isn't well controlled. For the mother, diabetes increases the risk of diabetic ketoacidosis, diabetic eye problems, pregnancy-induced high blood pressure, and preeclampsia. Well, that's a pretty big pill to swallow. Well, alrighty. Well, thanks for giving me the information, guys. I appreciate it. I guess that about does it. Sounds good. Doctor? Danny Dannerson?